The first of those would be kidney disease is one of the most underdiagnosed and quietly progressing health issues in the modern world. By the time most people realize something's wrong, those would be they've already lost significant function. The question is, can we do something about that earlier in the game? And the answer, yes, to a degree. B, what we'll talk about today are 8 natural drinks that support kidney health through metabolic, anti-inflammatory, and diuretic pathways. None of these will detox in the Instagram sense, but some of them do have credible mechanisms that support renal function. And over time, the first of those would be these small edges can matter. Let's begin by addressing something so obvious that it's often ignored: water. Plain, unflavored, those would be non-carbonated water, is the most essential and effective fluid for supporting kidney health. It doesn't come in a bottle with marketing buzzwords like Detox or cleanse, but it does something far more meaningful. It allows your kidneys to do the job they've evolved to do over millions of years. So filter blood, excrete waste, and regulate electrolytes. The first of those would be, most people underestimate the role of hydration in kidney function. The first of those would be chronic low-grade dehydration, the kind you might not even notice because you're sipping coffee or soda throughout the day, imposes a consistent, quiet burden on your kidneys. The nephrons, the functional filtration units of the kidney, depend on adequate plasma volume to maintain the glomerular filtration rate, GFR. When the first would be when that volume drops, so does filtration efficiency. Over time, that creates stress. The first of those would be, think of it as trying to wash dishes with just a trickle of water. You can still do it, but it takes longer and the residue builds up. Inadequate hydration is also a leading modifiable risk factor for kidney stone formation. Stones form when substances like calcium oxalate and uric acid become supersaturated in the urine. Dilution, plain and simple, reduces that concentration. If your urine is consistently concentrated, darker in color, those would be higher in specific gravity. You're creating the environment where crystals can nucleate and aggregate. Conversely, keeping urine dilute is like keeping roads free of traffic congestion. Fewer accidents, better flow. The data supports this. Studies show that individuals who maintain a daily urine output above liters have a significantly lower risk of recurrent nephrolithiasis, kidney stones. The first of those would be, but you don't need to track urine output unless you're already dealing with pathology. A more accessible metric is simply monitoring your fluid intake and more specifically prioritizing water over other beverages. Now, here's where the nuance comes in. Not all water consumption is created equal. The chugging a liter of water once or twice a day isn't as effective as distributing it evenly across your waking hours. The kidneys prefer steady state conditions. The first of those be bowls hydration. That is, drinking in large amounts infrequently tends to be less effective and can even lead to rapid diuresis, where most of the water is excreted quickly, providing minimal benefit. Instead, aim for a consistent intake that aligns with your activity level, body size, and climate. There are exceptions. If you have advanced kidney disease, heart failure, or are on dialysis, your fluid intake will need to be tightly regulated. The first would be, but for the average person, especially someone with early signs of kidney strain, like mildly elevated creatinine or microalbuminuria, consistent hydration is one of the simplest, least expensive, and lowest risk interventions you can adopt. No gimmicks. The first of those would be no supplements, just water, intelligently consumed. And while it won't undo years of damage or replace necessary medical therapy, first of those it's a foundational behavior that supports everything else. We spend so much time looking for silver bullets that we often ignore the basics. In kidney health, the basics are everything. The first of those would be, if there's one thing I try to emphasize in discussions around nutrition and longevity, it's that we need to move beyond hype and lean into mechanisms. So when people bring up lemon water as a kidney cleanse, my first instinct is skepticism, not because the claim is completely unfounded, B, but because of what's said online is missing the real science. That said, there is a credible physiological rationale for how lemon water, more specifically, the first those would be, the citrate it contains can benefit the kidneys under the right circumstances. Let's talk about kidney stones. B. Around 10% of people will experience a kidney stone in their lifetime, and recurrence rates are high, upwards of 50% within 5 years. One of the most common types is calcium oxalate stones. These form when calcium and oxalate become supersaturated in the urine, leading to crystallization and stone formation. The first of those would be, here's where citrate plays a protective role. Citrate binds to calcium, forming a soluble complex that reduces free calcium in the urine, which in turn lowers the likelihood of calcium oxalate precipitation. Lemon juice is one of the more accessible natural sources of dietary citrate. Roughly 4 ounces of lemon juice contains about 1.4 grams of citrate. Compare that to potassium citrate supplements, which are often prescribed to patients with hypocitraturia, low urinary citrate. And while lemon juice isn't as potent, it's a reasonable adjunct for prevention, especially in people with mild stone risk. A small but well-constructed study published in UKidney International showed that patients who drank lemonade therapy, essentially diluted lemon juice several times a day, had a reduced rate of stone formation compared to baseline. The mechanism was cleared urinary citrate levels increased and urinary saturation of calcium oxalate decreased. This is not anecdotal. It's an example of leveraging a dietary intervention to shift a biochemical parameter that directly impacts renal outcomes. But we need to be precise here. Lemon water is not a panacea. It does not flush toxins from your kidneys. That's marketing language, not science. If your kidneys are healthy, they're already filtering 50 gallons of blood a day and removing waste products with a precision no supplement can improve upon. The role of lemon water is specific. Reduce risk of stone formation by modifying urinary chemistry, particularly in people with a history of recurrent stones or borderline low citrate levels. The first of those would be, it's also worth noting that lemon juice can be acidic to the enamel of your teeth. So dilution matters. B, I often suggest people add 24 tablespoons of fresh lemon juice to a liter of water consumed throughout the day rather than all at once. The first of those would be, this provides enough citrate to be useful without the downsides of high acid exposure. For those tracking their kidney health proactively, perhaps because they have a family history or early stage nephropathy, adding lemon water can be a smart, low-risk strategy, but again, it's not magic. It's a supportive habit, not a cure. As with most things in health span optimization, consistency beats intensity, and fundamentals always come first. Green tea is one of those rare substances that sits at the intersection of cultural tradition, biochemical plausibility, and emerging clinical relevance. Those would be, but to talk about green tea intelligently, especially in the context of kidney health, we have to move past the headlines and look at mechanisms, context, and potential downside. The active compounds in green tea are polyphenols, particularly a catechin called epigallocatechin gallate, or EGCG. This molecule has been extensively studied for its EU antioxidant, EU anti-inflammatory, EU endothelial supportive properties. That matters because many forms of kidney damage, whether from hypertension, diabetes, or oxidative stress, share common downstream pathways, mitochondrial dysfunction, inflammatory cytokine production, and progressive fibrosis. EGCG appears to modulate several of these mechanisms. In preclinical models, green tea extract has shown promise in attenuating glomerular and tubular injury in diabetic nephropathy. That's one of the most common pathways to kidney failure today. We've seen reductions in markers like transforming growth factor, beta, TGF2, oxidative stress markers like malondialdehyde, and even histological improvements in renal tissue in rodent models. Now, these aren't randomized, controlled trials in humans, and we shouldn't overstate the translation. But when you consider the extremely low risk of consuming green tea in moderate amounts, the signal is compelling enough to merit attention. Where it gets particularly interesting is the potential role of green tea in supporting vascular health. The kidneys are extraordinarily vascularized organs. Each kidney contains roughly 1 million nephrons, each with its own microscopic filtration unit, the glomerulus, and an intricate capillary network. Anything that improves microvillar function, endothelial nitric oxide production, for example, has a potential protective effect on renal perfusion. EGCG has been to improve endothelial function in both animal and human studies, especially in the context of metabolic syndrome. But here's where I have to insert a cautionary note, and this is something that often gets missed in wellness circles. Not all green tea products are created equal. When consumed as a beverage, brewed from whole leaves, ideally without added sugars or flavors, green tea is relatively safe and well tolerated. But when EGGCG is concentrated into high-dose supplements, we start to see a different risk profile. First, those would be, there are documented cases of hepatotoxicity from excessive green tea extract use, particularly in fat-burning supplements. That's a dose issue. The first of those would be, the therapeutic window is narrow when you're dealing with high concentrations of bioactives. From a practical standpoint, if you're aiming to support kidney health, 283 cups of high-quality green tea per day, ideally consumed away from iron-rich meals since catechins can impair iron absorption, is a reasonable strategy. You're getting a modest dose of EJCG along with hydration and zero metabolic load, assuming it's unsweetened. But remember, green tea is not a replacement for glycemic control, blood pressure management, or early detection of renal impairment. It's a supplement to foundational health behaviors, a small lever that, when combined with others, may shift long-term outcomes. And in the world of longevity and chronic disease prevention, it's often these small, low-risk, consistent actions that compound to make the difference. Cranberry juice is one of those interventions that's been co-opted by both folklore and marketing, which makes it easy to dismiss. But that would be a mistake. While it won't cleanse your kidneys in any meaningful way, there's legitimate science behind its role in reducing the incidence of urinary tract infections, UTs, and extension, potentially mitigating downstream renal damage in certain populations. Let's back up. Recurrent UTIs are more than just a nuisance in individuals, especially women, who are prone to frequent infections. The risk of ascending bacteria reaching the kidney's GE, pyelonephritis, increases. Over time, repeated inflammatory episodes at the renal level can cause scarring, reduction in nephron function, and in some cases, irreversible damage. The kidneys don't regenerate, so anything that reduces infection frequency, particularly non-antibiotic interventions, deserves serious attention. Here's where cranberry juice comes in. The active compounds in cranberries are called a proanthocyanidins Paxculi, specifically type of Pax. And they have a unique mechanism of action. They inhibit bacterial adhesion, particularly of Escherichia coli, E. coli, the bacterium responsible for about 80.90% of uncomplicated UTIs. These PACs don't kill bacteria, which is important. They simply prevent them from sticking to the uroepithelial lining of the bladder and urinary tract. No adhesion means no colonization, which no infection cascade. Now, is this clinically relevant? In meta-analyses of randomized, controlled trials, unsweetened cranberry juice or extract has been associated with a modest but statistically significant reduction in UTI recurrence. First, it would be, particularly in women with a history of recurrent infections. That doesn't mean it's effective in everyone, and the Degree of benefit likely depends on pack concentration, dose, and consistency of use. Many commercial cranberry juices contain very little active compound and a lot of sugar, which ironically can worsen insulin resistance and indirectly harm kidney health over time. So formulation matters. First of those would be, if you're going to use cranberry juice for this specific application, namely reducing the frequency of UTIs and thereby protecting the kidneys from potential infectious insult, it needs to be GU unsweetened, heat concentrated, and taken regularly. Most of the studies showing benefit used formulations delivering of 306 to 7 2-min-G of PACs daily E, which is difficult to hit with standard juice. Cranberry supplements, when standardized to PAC content, may actually be more effective and more practical for long-term use, provided they come from reputable sources. First, those would be, there's also the metabolic piece to consider for individuals with insulin resistance, type 2 diabetes, or metabolic syndrome, all of which increase the risk for kidney disease. Drinking sugar-laden fruits is contraindicated. So again, the unsweetened qualifier isn't a detail, it's essential. In summary, cranberry juice, when used intelligently, isn't a gimmick. It's a targeted intervention for a specific problem, bacterial adhesion in the urinary tract, with downstream implications for renal preservation in certain populations. The first of those would be, it's not for everyone, and it's certainly not a standalone solution. But in the right context, with the right formulation and dose, the first of those would be, it's one more small lever that can reduce kidney strain over time. And in longevity-focused medicine, the first of those be these marginal gains, consistently applied, are where real progress lies. Beet juice is one of those interventions that sits in an interesting gray zone. It's neither mainstream medicine nor fringe biohacking. And while it's often lumped into the natural detox category, the real utility of beet juice, particularly for kidney health, lies in its vascular effects. Those would be, to understand where it fits, you have to start by looking at the kidneys not just as filters, but as evascular organs. Each kidney receives roughly 20% of the cardiac output at rest, which is significant. That blood supply is critical for maintaining glomerular filtration. The first of those would be regulating blood pressure and clearing metabolic waste. Beets are rich in U-dietary nitrates, which are precursors to nitric oxide, a signaling molecule that plays a central role in vascular tony, blue blood pressure regulation, and endothelial function. First of those would be, when you consume nitrate-rich foods like beetroot, the first of those would be, those nitrates are reduced by bacteria in your mouth to nitrites and then converted to nitric oxide in your stomach and bloodstream. The result is vasodilation. Essentially, the blood vessels widen, which improves blood flow and reduces systemic vascular resistance. That's not speculative, it's measurable. Numerous studies show that beetroot juice can lower systolic and diastolic blood pressure, particularly in hypertensive individuals. Why does that matter for kidney health? Because chronic hypertension is both a cause and consequence of kidney disease. As blood pressure increases, the glomeruli, the microscopic filtration units in the kidney, are exposed to higher pressure loads. Over time, this leads to glomerulosclerosis, a form of scarring that progressively reduces kidney function. Anything that improves endothelial function and helps lower blood pressure without additional pharmacologic burden is worth exploring, especially for early stage kidney disease or pre-hypertensive states. There's also evidence from animal models suggesting that nitric oxide bioavailability may protect against ischemic renal injury and modulate the progression of diabetic nephropathy. While we don't yet have large-scale human trials looking at beet juice specifically in CKD patients, the vascular benefits alone justify its consideration. With caveats. Here's where we need to be precise. Beets are high in oxalates, and for individuals who are predisposed to calcium oxalate kidney stones, this is non-trivial. because those would be oxalates combined with calcium in the urine and promote stone formation, particularly in those with low citrate levels or underlying metabolic risk factors. So this is not a one-size-fits-all intervention. If a patient has a history of kidney stones, especially oxalate-based stones, then beet juice may actually be counterproductive. That's a classic example of how something that's beneficial in one physiological context can be harmful in another. Dosage also matters. Most of the research showing hemodynamic benefit used about a 250 to 500 ml of beetroot juice, standardized to E3500 mg of nitrates. This isn't about drinking a small glass every now and then. You need a meaningful dose, consumed consistently. The first dose would be to drive nitric oxide pathways in a way that can impact endothelial function or blood pressure. HEROs would be. And it's important to note that high heat processing and certain storage methods can degrade nitrate content. So fresh or cold pressed juice is generally superior to shelf-stable versions. There's also a behavioral consideration. Beet juice causes guberturic, red, or pink urine, which is harmless but can alarm people if they're not expecting it. More importantly, the first of those would be individuals with iron metabolism disorders or certain forms of porphyria should avoid excess dietary nitrates as they can interact with heme synthesis pathways. In the context of longevity and kidney protection, beet juice is a tool, not a fix. It supports one axis, vascular function. That's critical to renal perfusion and systemic blood pressure. But it must be used with awareness of individual risk factors, particularly oxalate sensitivity, when integrated into a broader framework of blood pressure control, glycemic regulation, and proactive screening. It's another small but meaningful lever. As always, the question is not, is this good or bad? But in whom, under what conditions, first those, and to what end? That's where the utility lies. When people talk about dandelion tea, it's usually in the context of detox, a term I tend to avoid unless we're speaking pharmacokinetically. The reality would be, if you're looking at this through a mechanistic lens, rather than through wellness folklore, dandelion tea actually does offer some interesting, albeit nuanced. First of those would be properties that can intersect with kidney health, particularly in the realms of fluid balance, mild diuresis, and hepatic renal crosstalk. Dandelion taraxacum officinale is a plant that's been used in traditional medicine systems for centuries. Not because it's magical, but because it interacts with a few core physiologic systems, the liver, the kidneys, and the gastrointestinal tract. The tea, typically made from the roots or leaves of the plant, contains a mixture of phytochemicals, including flavonoids, terpenes, and inulin, no prebiotic fiber. But the primary focus from a renal standpoint is its mild diuretic effect. Let's unpack that. Diuretics, in the pharmacologic sense, are used to reduce blood volume, lower blood pressure, and offload excess sodium and water, often in the setting of hypertension, edema, or heart failure. Dandelion doesn't rise to that level of potency, those would be, but studies have shown that it can increase urine output modestly in healthy individuals. In one small human trial, participants who consumed dandelion leaf extract saw an increase in urinary frequency and volume within a few hours. That's real. It's not anecdotal from a mechanistic standpoint. This effect is likely mediated through dandelion's potassium content and certain compounds that may mildly inhibit sodium reabsorption in the nephron. Those would be. Think of it as a plant-based thiazide with far less potency and without the electrolyte disturbances. That said, the FERS would be, this isn't a substitute for diuretics in patients with clinically significant fluid overload, but for individuals with early stage hypertension or mild volume retention, especially those looking to avoid polypharmacy. It's an option worth considering as part of a larger strategy. There's also a liver-kidney connection worth addressing here. Dandelion root In particular, first of those has been shown to support hepatic enzyme activity, including phase I and I detoxification enzymes. Why does that matter? The first of those would be because the liver and kidneys don't function in isolation. Hepatic dysfunction, whether due to fatty liver, insulin resistance, or toxin exposure, places a secondary burden on the kidneys. The two systems are metabolically linked by supporting liver function, which dandelion appears to do via upregulation of antioxidant enzymes like glutathione peroxidase and catalase. You may be reducing the downstream workload on the renal system. Additionally, dandelion root contains Jew-iling, a soluble prebiotic fiber that modulates gut microbiota. This is not trivial. There's increasing evidence that gut that derived uremic toxicities such as indoxyl sulfate and p-cresyl sulfate contribute to renal inflammation and progression of chronic kidney disease. By feeding beneficial bacteria, inulin can help shift microbial metabolism away from these harmful byproducts. Again, small effect size, but directionally meaningful over time. That said, a few caveats are in order. First, the diuretic effect, while mild, may pose issues for individuals on certain medications, particularly lithium or antihypertensives. Second, dandelion has a relatively high potassium content, which may be problematic for individuals with advanced chronic kidney disease or impaired potassium excretion. Hyperkalemia isn't subtle, and for CKD patients, even small dietary changes in potassium can have outsized impacts. Also, quality matters. Those would be the supplement industry is underregulated, and not all dandelion teas are created equal. Ideally, you're using organic, single ingredient formulations without added licorice root, sugars, or synthetic preservatives. And if you're using the tea therapeutically, as opposed to just as a warm beverage, you should be tracking clinical markers over time: serum creatinine, EGFR, potassium. The first of those would be, and maybe even urinary output if fluid balance is in question. In short, dandelion tea is not a miracle, but it is a biologically active substance with the first of those would be measurable effects on urine output, liver function, and the gut-renal axis. In the right context, used intelligently and in coordination with objective markers, it can be a small but potentially meaningful lever in a kidney supportive lifestyle. The first of those would be key, as always, is to move past narratives and into mechanisms. That's where the signal lies. Ginger tea is often tossed around in conversations of digestive health, immunity, and natural detox, usually with a vague appeal to tradition and anecdote. Those would be. But if we filter that noise through the lens of physiology and evidence, something I always advocate for, what we're left with is a compound that may not be kidney specific per se. Those would be, but has enough anti-inflammatory and metabolic effects to merit attention, especially in the context of preserving long-term renal function. Would be the primary bioactive compounds in Jerzingiber officinale are gingerols and sugals, phenolic compounds that exert effects across multiple biological pathways. Beet, these molecules are best known for their inflammatory and antioxidant and anti-NARSI properties, but let's zero in on the two aspects most relevant to kidney health: systemic inflammation and glycemic control. Chronic inflammation is a common denominator across almost every disease of aging, and kidney disease is no exception. In fact, one of the key accelerators of chronic kidney disease, CKD, is inflammatory signaling in the renal parenchyma. Think TNF-alpha, IL-6, and other cytokines driving fibrosis, scarring, and functional decline. Ginger has been shown to downregulate some of these pathways, both in vitro and in vivo. For example, a study in diabetic rats demonstrated that ginger extract could significantly reduce markers of renal inflammation and oxidative stress. The first would be the reduction in renal malondialdehyde ZO marker of lipid peroxidation was particularly telling. Human data, while more limited, is moving in a similar direction. Small clinical trials have shown that ginger supplementation can reduce CRP-C reactive protein, fasting blood glucose, and HbA1c levels. All important markers. The first of those would be, especially if we're thinking long-term about preserving glomerular function. Why does that matter? Because diabetes is the leading cause of CKD globally. The first would be anything that helps blunt postprandial glucose spikes or improves insulin sensitivity isn't just helpful. It's essential. The mechanisms here involve increased GLUT4 translocation in muscle tissue, enhanced insulin signaling, and possibly delayed gastric emptying, which flattens glucose excursions. Now, where ginger tea becomes especially practical is in its ease of incorporation and safety profile. Unlike more aggressive interventions, the first would be ginger tea, made from fresh root or high-quality dried pieces. Delivers modest, steady-state levels of bioactives without the risk of hepatotoxicity or drug interaction that you might see with more concentrated extracts. It's also caffeine-free, low in oxalates, and generally well tolerated by people with renal impairment. One point that's often missed is ginger's impact on blood pressure. There's emerging evidence that it may act as a mild ACE inhibitor, the same enzyme targeted by drugs like lisinopril. In one randomized controlled trial, those would be a daily ginger intake was associated with significant reductions in both systolic and diastolic blood pressure over a 12-week period. The first of those would be, if you've heard me talk about kidney health before, those would be, that controlling blood pressure is arguably the single most important lever we have in preventing or slowing nephron loss. Even a 50-10 mH reduction in systolic pressure can make a dramatic difference in long-term renal outcomes. But as with all interventions, the dose and context matter. First would be, most studies showing benefit used 23 grams of ginger daily. The first of those would be, that's hard to achieve with tea alone unless you're using fresh ginger root in fairly high concentration. Think a tablespoon or more per cup, steeped for at least 10-15 minutes. The commercially available ginger tea bags, they're largely underdosed. So if you're using this therapeutically, preparation technique matters. There are a few minor caveats. Ginger can thin the blood slightly due to its impact on thromboxane and platelet aggregation. B. So if someone is on anticoagulants or about to undergo surgery, it's worth checking in with a clinician before consuming large amounts. That said, the first would be, for the average person, especially one with mild hypertension, insulin resistance, or metabolic syndrome, a few cups of well-prepared ginger tea daily can be a low-risk adjunct that moves the needle in a meaningful direction. It's not a cure, and it won't regenerate nephrons. The first of those would be, but in a framework where we're stacking marginal gains, where every small advantage compounds over time. Ginger tea earns its place. Not because it's trendy or traditional, but because the mechanisms align with the outcomes we care about. And that's the litmus test that always matters. The turmeric milk, often called golden milk, tends to get a lot of airtime in wellness circles, usually accompanied by vague claims around detoxification, immune support, and anti-aging. Most of that is marketing noise. But beneath the hype, if we dig into the pharmacology of curcumin, the active compound in turmeric, and the physiology of chronic kidney disease, CKD progression, we find a plausible, evidence-informed case for its use. Not as a standalone treatment, but as a small lever within a larger framework aimed at reducing systemic inflammation, oxidative stress, and metabolic dysfunction. Let's start with the basic. Turmeric curcuma long contains a family of curcuminoids, with curcumin being the most well-studied. The first of those would be, what makes curcumin interesting in the context of renal health is its multimodal anti-inflammatory and antioxidant properties. It's been shown to inhibit nuclear factor B-kappa NFBJ, a transcription factor that regulates the attrition of pro-inflammatory cytokines like TNF-F, IL-11, and IL-6, all of which are elevated in chronic kidney injury. Chronic low-grade inflammation is a key driver of glomerular and tubular damage, ultimately leading to fibrosis and nephron loss. So anything that modulates pathway in a clinically meaningful way is worth examining. The first of those would be in rodent models of diabetic nephropathy and other kidney injury paradigms, curcumin has been shown to reduce proteinuria, improve glomerular structure, and downregulate oxidative markers like malondialdehyde, MDA, while boosting endogenous antioxidants like superoxide dismutase, SODT, and glutathione. That's a signal worth paying attention to, albeit one that hasn't yet fully translated into large, high-powered human trials. First of those would be, but some smaller studies in humans have shown promise. One trial found that patients with lupus nephritis taking curcumin had a significant reduction in proteinuria and hematuria compared to placebo. Another study in patients with diabetic nephropathy showed improved eGFR and reduced serum creatinine with curcumin supplementation over an 8-week period. So what does this have to do with turmeric milk? Traditional golden milk includes turmeric, black pepper, which contains piperine, be a bioenhancer that dramatically increases curcumin absorption, and a fat source, usually whole milk, coconut milk, or almond milk. The first would be the fat matters because curcumin is fat soluble, and the piperine matters because it inhibits glucuronidation in the liver, which would otherwise rapidly metabolize and eliminate curcumin from the system. This trio, curcumin, piperine, and fat, creates a delivery system that allows for better bioavailability than turmeric alone. But here's the caveat, would be the dosage in most culinary preparations is far below what we see in therapeutic studies. A cup of golden milk might contain 2,300 mg of curcumin, while most trials showing benefit use doses in the range of 5,000 to 2,000 mg daily. And even then, bioavailability is a limiting factor. So if you're going to use golden milk as part of a renal protective protocol, it needs to be consumed consistently and prepared with the right ratios of turmeric, pepper, and fat. Otherwise, you're just drinking a comforting beverage with a hint of spice. Now let's zoom out. Why would this matter for kidney health beyond inflammation? Because systemic inflammation does just damage the kidneys directly. It also exacerbates insulin resistance, endothelial dysfunction, and hypertension, all of which are upstream contributors to CKD progression. Curcumin has shown benefits across all three of those domains. It improves endothelial nitric oxide availability. It reduces insulin resistance, and it modulates the renin-angiotensin system, albeit modestly. These effects don't just live in isolation. The first of those would be they interact with the broader physiological web that dictates kidney health over time. That said, turmeric is not without risk. High doses, particularly in supplement form, have been linked to G-upset, increased bleeding risk due to antiplatelet effects, and in rare cases, liver enzyme elevations. So if someone is on anticoagulants, antiplatelet agents, or has hepatic impairment, they need to be cautious. Likewise, not all turmeric powders are equal. Contamination with heavy metals like lead and poor standardization of curcumin content are ongoing concerns in the supplement industry. In sum, turmeric milk isn't magic, but it's a delivery system for a compound, curcumin, with a growing body of mechanistic and clinical evidence supporting its role in reducing the inflammatory and oxidative burden that contributes to renal decline. Used intelligently, consistently, and in the right biochemical context, it's a low-risk, potentially high-reward intervention. As with all things in medicine and longevity, the nuance lies not in whether it works, but for whom, how much, and in what combination with the rest of their lifestyle and medical care.